Hello. So my name's Bob, and I've got to get my wisdom tooth removed. That one there on the left. And I thought I'd make a video, kind of logging my journey. I've watched other people's videos, and they've been helping me. So I thought I'd just kind of tell my story. I haven't had it out yet. Then, so my the surgery is on Friday, so 3 days away. And I thought I'd just log my story. So I'm 42, and I've been told that I've got like a 25% chance of permanent nerve damage. And I was also told that my tooth was too decayed to get a coronectomy. But I've since learned that there may actually be still a possibility of a coronectomy. So I'm kind of in limbo at the moment, waiting to find out if I'm going to get a coronectomy or full extraction. But 25% chance of nerve damage is quite scary. There's my nerve there. I think it's the inferior alveoli or something like that. I can't remember. I don't think it's lingual. Might be. And it goes right across the root there, near the tip. Yeah, there. Can't have a coronectomy. Quite risky. And I'm 42, so my bone is quite dense and things like this. But I've since learned that there is a chance of a coronectomy. So I'm going to have to wait and see about that. I think I'll start the story, though, at the start, though. I'm just going to kind of vent. I'm not expecting many people to watch this anyway, but the story starts, though, when I was about, I don't know, late 20s, early 30s. I remember noticing, I thought I had something stuck in my tooth, and I kept kind of tonguing this little lump at the back of my gums. And I eventually looked at it and realised it's actually a bit of tooth growing through. And I thought, oh, look at that. I've got a bit of tooth growing through at the back of my mouth. Didn't think anything of it. Carried on with my life. Didn't think anything of it. I guess it was growing more and more. And then eventually last year, about a year ago, a little bit cracked off of it. You know, when you can tell a bit of tooth has cracked off somewhere in your mouth when you're eating your food, and you think, oh, there's a hard bit there, and you think that's a bit of my tooth, isn't it? I'm pretty sure a little bit of tooth cracked off of it, because I inspected it afterwards and noticed there was a little hole, kind of. So I guess if you look on this here, I guess that went a bit flatter and just a little chunk, so it goes a bit deeper now, and I get food stuck in it and stuff. Little chunk fell off. But at the time, this is the thing. I don't think I knew anything about wisdom teeth at all. I think I actually thought that little tooth at the back of my mouth there was just this like inert piece of extra bone that wasn't doing anything. I wasn't even imagining it having roots or anything. I didn't. I mean, it feels amazing to me now that I know so much about. I've been researching like a madman the last couple of months about wisdom teeth, and it's like it seems so obvious now. But I just don't think I'd even thought about it. If you had asked me where are your wisdom teeth, I might have guessed like somewhere at the back, like maybe your second molars or something like that. I don't think I'd really thought about it. And I'd seen all these videos of kids after their wisdom teeth removal on laughing gas and all these funny videos. But even then, I just didn't put two and two. I never asked the question in my head, like what exactly are they? I just, some people get braces, some people get wisdom teeth removed. I never even asked the question. So I was very, very clueless about what wisdom teeth even are. And I guess I say that because if I had known what I know now, when I had that chunk crack off, I'd have gone straight to the dentist straight away. But because I just didn't think anything of it and I wasn't feeling any pain, I just procrastinated and left it, and I didn't do anything about it. Because I figured it was probably very unimportant at the back of my mouth. And actually, it's the most important tooth, really. One of them seems to be. So, and I would have cleaned it better as well when I first saw it emerge. If I had known what I know now, I would have cleaned it better as well. But anyway, that's all hindsight. Any young people out there, take care of your wisdom teeth and make sure people know, because they're quite important. But anyway, a piece cracked off of it. It happened to crack off at a time. Last year, I was going through a phase where I was just kind of procrastinating. I'm not usually that procrastinating, but I was going through a particularly procrastinating phase last year, and I was eating lots of chocolate biscuits, more than I normally do, and I was just, binging, and I wasn't, I was relaxing. I was enjoying my life for a bit, and so I just put off going to the dentist, and I was eating shed loads of chocolate biscuits, which is just looking back now is like, oh man, I've like since I found out I've got to get it out. I've barely eaten a chocolate biscuit. I've just cut out sugar entirely because I just don't want to get any more decay because I want to have a possibility of a coronectomy and stuff. So I was cleaning it out. I didn't like getting food stuck in there, so I'd always pick it out. I had a water flosser that I liked it clean, so I wasn't too bad with the cleaning of it. But I doubt I was brushing it particularly well. I am now, but I wasn't then. And so for about a year, it was decaying. I had a little hole there, and I guess food was getting trapped in there. I was cleaning it best as I could, but not very well. And it's causing this decay in my second molar. I don't know whether it's the food getting stuck in there that's causing it, or whether it's just this tooth pushing against that one. I think it might just be that it's pushing against. That's what my dentist said. My NHS dentist said that the wisdom tooth is pushing against the second molar and is going to cause decay there, and I'm probably going to need a root canal. 80% chance I'll need a root canal in this tooth at some point, she said. So that's a bummer. That's again, I should have got it sorted out sooner. Yeah, it's mad that it happened at the one point in my life where I just started procrastinating like mad. I just putting off things all the time, and that was like the worst time to be procrastinating. But anyway, so that's what's happened. I eventually went to the dentist, went to the NHS dentist, and I was just fully expecting her to just put a little filling in there. Again, I didn't think anything of the wisdom tooth. I thought it was just an inert piece of tooth. Stick a little fill in, everything will be fine. We did an X-ray, and she was like, "Yeah, you're going to have this wisdom tooth removed, and you might need a root canal on this at some point." So that was a bummer, and it gave me a little bit of a spiritual slap in the face because I've been procrastinating so much. It was like, oh man, I need to get my life in order. So that's what I've been doing the last couple of months. So that wisdom tooth, you got to get the wisdom tooth out. And so then I started researching it. Still at this point, not thinking much of it. Like, okay, just get it out then. Like most of the time when you go to the dentist, it's not that big a deal. I've had a root canal in this tooth. I don't remember it being painful or anything. It was, you have to eat soft foods for a while and things like this, or eat on the other side of the mouth, but it's no real big problem. So I wasn't too worried. But as soon as I started researching about wisdom teeth removal, I started to get worried. The first thing I learned was that the older you get, the more complicated and risky it can be. You're supposed to get them out when you're young, 18 to 24-ish. And I am 42. And I was reading about that being a bit more risky. Started reading about nerve damage as well and the risk of that. But I was still kind of playing it downish. I mean, I was getting a bit worried. My way of dealing with things is to try and make peace with the worst case scenario first, and then just kind of everything else on top of that is a bonus, and then just trying to kind of come to terms with what's likely to happen. And the worst case scenario I figured was like permanent nerve damage. But then I was kind of coming to terms with that, and I kind of thought I could, if that happens, I could live with it. I don't want it to happen, but if it does, I figured I could live with it. And one of the things I realised as well was that if I get permanent nerve damage, the most likely permanent nerve damage will just be numbness, which is that if I've got no feeling at all, just be numbness. Because if I feel any feeling at all, some of the other ones, like what if you get permanent burning sensations and things like this, I figured that would be a sign that there's at least some sensation there, and therefore you have a chance that your nerves might actually heal. It might be a sign that your nerves are healing, and because nerves do heal slowly, like 1 millimeter a day or something like that. So that kind of calmed me down a bit, and I thought, well, okay, so realistic worst case scenario. I mean, I know there are all kinds of rare circumstances where it could be really bad, and maybe you have some pain and stuff, but permanent pain. But I thought the realistic worst case scenario was permanent numbness, like when you go to the dentist, get local anesthetic, and your face feels all puffy and weird. And I wouldn't want that, but I kind of felt like I could probably live with it. I could just come to terms with it, because people do, pain. Like lots of people live with pain, and I've seen like psychological studies of people who like lose limbs or go blind, and their happiness levels obviously drop for the first year, maybe two, of course, but then their happiness levels just eventually go back to where they were before, which is that people just kind of get used to it. You just adapt. Everybody has like a base level happiness level, and whatever happens in life, you tend to just kind of get used to things, and you just make do. And then you get back to your normal happiness level, and lots of people live with types of pain, and I kind of feel like we all live with pain every day, but a lot of it is we're so used to it we don't even think of it as pain. But like, I mean, little things like I've got tinnitus that I've just forgotten about now. I just get used to it. It's not very bad, but I have a little bit of tinnitus. General tiredness and fatigue people just live with, and just, you know, I had tennis elbow for most of last year. Still got a little bit of it. Just get on with it. And then also like mental pain, like when you just feeling anxious and depression and stuff like that. We all have experiences like that, and we just live with it and we deal with it as part of life. We carry it around with us. So, and in fact, to the extent where some of the pain we have, we almost wouldn't want to lose it. There are some conditions we have where we're so identified with it that we actually would feel weird without it. Like, it's like when people go to prison and then they get they don't want to leave after prison or something. It's quite scary. And I just think familiarity is what people like, and it's change people don't like, or at least myself. And so I feel like obviously right now I don't want to have permanent numbness, but I just think I'd just get used to it. I'd figure it out. I'd learn to kind of like go careful on that side, try not to bite my tongue, maybe my language, my speech would change. I don't know. So anyway, that's making peace with the worst case scenario is permanent numbness. So I had kind of made my peace with that. I thought, okay, that's fine. But then I thought, well, realistically, it's probably not going to happen. Like, it's from what I was reading, the chance of permanent nerve damage was only about like 1 or 2%, and maybe 10% temporary nerve damage, but like that's it. And so I was thinking, well, look, that's still like 90% chance. It'll just be fine. You know, I'll after the operation, my nerves sensation will come back, and that's what will happen. So I was resolving myself to be like, yeah, okay, so that it'll be fine. I have a friend who's a dentist, and I emailed her as well, and she was saying basically the same thing. Is she'd never come across anybody who'd have nerve damage. I think there was one case of somebody who had some temporary nerve damage, but that was because the anaesthetic was actually must have hit a nerve. I think that was the idea. So it was a very rare occurrence, and that was only temporary as well. So it's like, so that was calming me down. I thought, yeah, it's probably rare. Don't need to worry about it. And other things, like I was reading things about dry socket, and infection and things like this. But dry socket was like, it doesn't sound nice, but that was temporary as well. And anything temporary was just like, I'll just deal with it. I have had pretty hardcore pain once before with this one that had the root canal surgery on it. That was just, I had these little sensitive sparks of pain I used to have for like a couple of years. It just every now and then it would be really hardcore pain, and I'd like wince, and then it would just a flash, and then it would go, and I just ignored it. I must have just not gone for the dentist for ages because nothing happened with it. And then eventually it I felt pain, and the pain just stayed there and just wouldn't go away, and it was just like this really hardcore pain. I took painkillers, and at first I didn't, you know, 'cause I don't normally take painkillers, so I didn't know how many to take, and I couldn't get the pain away. I tried some clove oil, and that made it worse, and it was like stinging, and every time I didn't know what foods were helping or not, so I was eating and drinking cold foods, hot foods, and that was activating it and making it worse, and I had this real horrible pain. And I tried to go to bed, and that didn't work either. That made it worse when I went to bed. You know, not knowing it, not realizing that, because when you put your head down, all the blood goes to your head, and then that's why it hurts more. So you got to sit up and stuff. So I had some real hardcore pain with that tooth. It was just like I couldn't go to sleep, and I was on the verge of calling 111. I remember like 3 in the morning. I had to work. I had to be up at 5 in the morning. It was about 2 in the morning. I had to be up at 5 in the morning for work, and I hadn't slept at all. And I was sitting on the lounge on the sofa, sitting up, because I think by this point I'd realised that it was lying your head down makes it worse. So I was sitting up, and I thought, if I can't get to sleep in the next hour, I might just call 111 and go to the hospital and just have them yank the tooth out or something, because it was quite painful. So that was one of the worst pains I've ever had. But the reason I say it is because I made it through. It was all right. Yeah, well, it was just this throbbing pain. It's uncomfortable, and I eventually did get to sleep. I managed to get some sleep. I got a couple of hours, so that was good. Woke up, went to work. Once I got to work, got moving, it was all right. And then I realised that I learned to take painkillers the right way. So, well, for me, it was like paracetamol, and then 2 hours later Nurofen, and then 2 hours later paracetamol. I started getting into I didn't realise that you can alternate paracetamol and Nurofen, take them at the same time. So I was doing that, and that helped massively. Foods, don't have any salty foods or sugary foods, hot foods, cold foods, just eating real plain foods, eating it on the other side. That was all helping. Sitting upwards when you sleep upwards so the blood doesn't rush to your mouth, all this kind of stuff. And I basically just learnt to adapt. This is what you do when you get pain. You just you figure it out, you learn to adapt, and then it becomes okay. And I managed it, and I think for about, I don't know, I had pain for about 4 or 5 days, and then it went, and I think they said the nerve must have died or something like that. I don't know. Eventually the pain went. So I've had some intense pain, so I'd imagine dry socket it's probably worse, but it's probably similar, in the sense of painkillers not working well enough to dull the pain. So dry socket, I think I can deal with. Infection, you can have antibiotics. I can deal with all of that. It's just that permanent nerve damage that is the one that was worrying me. But anyway, so I think I was okay with that. Then what happened next then? So then I had to decide whether to go private or not. And one of the biggest fears I had, which is something, I don't know, it's something separate, something personal, but like, I really didn't want to have time off work, even though I'm just a cleaner. Like, I shouldn't be this. It's just a minimum wage cleaning job. I shouldn't care, but I do care about my jobs. I'm probably the one. I've got 2 cleaning jobs, and I'm probably the one in both of these jobs that takes the most responsibility. Like, I'm the one who I'm always there. I never have days off, and whenever anybody else has a day off, I cover, and I'm the one who is there the longest. I make sure everything gets done. It's like I just take responsibility and make sure everything gets done. And I don't like having days off. I don't like asking favors for other people or anything like this. And the thought of having to have time off was really bothering me. And so the idea of going private just meant that I can choose when I have the surgery, because on the NHS the waiting list is like 8 months, I think they said, something like that at least. And so it's just going to happen. I'm never going to get the choice of when to have the surgery. I was also anticipating that I would need twice as long recovery time because I'm 42. And so when I was reading about recovery times being like 3, 4, 5 days, you can go back to work, I was thinking, well, for me, I'm probably going to need 7, 8, 9 days or something. So that was something I was thinking about. So yeah, the decision to go private. So I was worried about taking time off work, which I probably shouldn't be, and that's probably something I need to deal with. Like, I'm a bit of a control freak. Like, I don't know. I don't like letting people down. So I wanted to go private. I also thought private would probably be better, and it'd probably be just a better service, which it has been so far, at least to the extent of like I can just ask a few more questions. Like, if I get it done on the NHS, I'm assuming that I'd have one consultation, then I'd be in the operating surgery, and it would just get done. I wouldn't have much choice and much say. I don't know. I think I just thought private would probably be better. And it has been a little better so far. So start of April, I went to the NHS dentist. She told me how to get the teeth out. Then about a month later, I decided to pursue the going private. And all the while as well, and all throughout April, I've been on this massive health MOT mode. Just I've been doing blood tests, I've been doing keeping fit, not eating chocolate biscuits, exercising. Just don't know why. Just like it's like I'm in training to make sure that I'm as fit as possible, and my body is as good as possible, so I can heal as quick as possible and stuff. So I've been doing that as well. Then I went to this private dentist, and he said to me that my tooth was very high risk and I couldn't have a coronectomy. He said it was like 20-25% chance of permanent nerve damage, and my tooth was too decayed for a coronectomy. The roots are curved. He said that makes it high risk. You've got the nerve coming across here. I've seen other videos of where the nerve is kind of underneath the roots, but this one actually goes right across the side of it. So I can imagine that being tricky to get out. I don't know how it works. Horizontally impacted as well, which is apparently trickier, I think. I mean, it's kind of vertical a little bit, 20 degrees-ish. So that worried me. And again, I went back to just making peace with the worst case scenario. I just started thinking, well, 25% chance I get permanent nerve damage. I'll make my peace with that. 75% chance I won't. So fingers crossed I'll be all right. But then, because I did it privately, the surgery had this thing where they send you an email afterwards asking, is everything okay? Do you have any questions and stuff? So that's a service you're probably not going to get on the NHS. And I really appreciated that, because they asked me if I had any questions, and I thought, well, I do have one question, which is, should I get a CBCT scan? And they said yes. Now, I've since learned, because the oral surgeon didn't ask me for a CBCT scan. He didn't even mention it. And I kind of thought, well, is that a good sign or a bad sign? I've since learned that a lot of oral surgeons, I think they just don't need it. And I've seen some studies to suggest that it doesn't actually make much of a difference. So I'm imagining a lot of oral surgeons just don't feel like they need it. It doesn't make much difference. They know what they're going to happen, just what to expect looking at this. But I've heard other oral surgeons say that on the internet, say that, you should get a CBCT scan. It does help, just minor things. So I went to get a CBCT scan, and here it is. And I'm glad I got it. But the big thing that happened in the CBCT scan was that I went to see a different dentist. This wasn't the oral surgeon. This was the head dentist of the surgery. And he looked at my scan, and he said, oh, you'll probably get a coronectomy. And I went, oh, the oral surgeon told me that my tooth was too decayed for a coronectomy. And he said, he's the oral surgeon, so don't take my word for it, but I don't think your tooth is as decayed as he thinks it is. And so that just popped the idea of a coronectomy in my head. And I was like, because I'd just totally written it off. I thought, well, decayed tooth, no coronectomy, that's it then. And so suddenly that came back into my head. And I don't know if I haven't described what a coronectomy is, if anybody doesn't know, but you basically just take the crown off. The oral surgeon will drill off the crown and leave those roots in. And apparently it works very well. In fact, everything I've looked into it, all the studies seem to suggest that it's kind of better outcomes. Less infection, less dry socket, certainly less nerve pain, less pain altogether. I mean, it's a bit mixed results. It's certainly it doesn't seem to be worse. I found one study that was a systematic review. I should probably I'll try and leave some links to some of these studies in the description. One was a systematic review of all the literature comparing coronectomies to full extraction, and the coronectomies I think they were coming out slightly better, I think, on the whole. I'll have to double check it, but it was all just generally better, and obviously you avoid the risk of nerve damage. So that was sounding really good to me, a coronectomy. Just the idea that you just take that little chunk off, leave the roots, don't have to touch the nerves. It's not going to affect that tooth anymore. It's fine. So the idea of a coronectomy popped into my head. And there's lots of other benefits to coronectomies. So when you leave the roots in, the roots will eventually slowly migrate, apparently, which is that they move. Your teeth are somehow slowly moving, or these ones are, when there's nothing to bump up against. But they move away from the nerve, usually. Like most of the time, they'll actually move away from the nerve. And so if you do have to go back for the roots for any reason, if they get infected, within about a month, 3 months, maybe a year, they'll actually be moved further away from the nerves anyway. And so it's less nerve damage risk as well. So I just thought, well, that sounds good as well. Like even within a month, they've moved a little bit, I think. So that sounds good. Coronectomy, everything about it sounded good to me. I think it's a slightly trickier procedure for the surgeon, maybe. And also sometimes when you have a coronectomy, the roots actually move, and if they move, then you have to take the roots out. So there's, even in a coronectomy, there's always a risk that the roots may have to come out anyway. But I'm guessing my roots are probably not going to move that much because I'm 42, so my bone is probably denser, and the roots are curved as well, which I'd imagine they'd be lodged in there a little bit harder. It's a weird one, the idea of leaving your roots in, because you think, isn't that just going to expose all this pain and all these, these roots and these pains just going to be exposed? Normally when you get pain in your tooth, it's because you've got a hole here, and then the roots get exposed and you get the pain. But apparently not. And apparently, from the literature I've read, it's almost surprising to people like that you don't. But it's almost as though you cut it off, and then a blood clot forms over the top, and then bone forms over the top of that, and it's like it just you just doesn't feel pain. It just seems to be fine. So yeah, don't understand how that works, but coronectomy sound really good. So yeah, he put that idea of a coronectomy in my head. And if I have a quick look at the CBCT scan, the other thing that I was glad I did it, because you can see how close, I think you can see how close the nerve is. So here's my tooth, here's the wisdom tooth here, and the chap drew where the nerve canal, the inferior alveolar nerve goes right across the middle there. And these are the two roots, so that's the lower one. Now, I don't think that red dot, that line, I don't think that's the actual nerve. I hope not. I think that's just where the computer has kind of filled in a line, a rough line, an approximate line. I think it's there's just next to it. If you look on one that hasn't got this cross on it, there's a little black kind of canal, little hole, and you can just see it kind of wrap around that curve, wrap around the root, just to the left of it. Kind of goes skinny, and then goes forward and keeps going on. If you go up here, you can see there's like this black mark there. So that's the root. That's the root canal coming down there with that red with like black around it. And when it goes around that root, it kind of gets squashed and it's very skinny around the outside of it. I don't know what this is. Is this the bone? It looks pretty cramped and squashed, wrapped around the side of that. It comes down and eventually you see it kind of do that. So it goes, there's the canal there. So that's the normal width of it, I think. That's when it kind of comes down to the front there. I think it must go into my mouth somewhere. So that's the normal width of it. But when it wraps around that lower root, it's just a little skinny little black line there. So I don't know how much I should worry about that. It sounds like looks a bit tight. I'm imagining, I mean, that's the root as well, so it's kind of, this is from the top, the cross section from the top, so yeah, it really wraps around the tooth. I don't know how he's going to get it out with the coronectomy. I presume if you had to get those roots out, hopefully they would just come out in one. If it's mobile, you give it a little wiggle and it'll come out in one, and you could just slide it out, and then the nerve, you wouldn't even have to touch the nerve. If not, you would drill on the other side of it and then kind of try and pry it out that way. He did talk about leaving tips in. So here you might be able to leave that little tip in, which I guess is like a mini coronectomy. And perhaps on the side here, you could just leave a bit of that, just a little bit of it, and just drill around the edge. But yeah, that must be hard to get that root out. So I'm not sure what's going to happen there. But hopefully I'll have a coronectomy. The situation though at the moment though is, so basically the oral surgeon originally said, your tooth is too decayed, so we can't do a coronectomy. That's what he said. And so we're going to have to do full extraction. And then it was the head dentist who said, no, I think you'll probably have a coronectomy. And so And then I asked for a clarification, but the oral surgeon said he's going to have to decide on the day. He's not sure at the moment. He'll have to decide on the day. So I'm kind of in limbo. And I've been trying to figure out. If how common it is and if it's possible to have a coronectomy on decayed teeth. I have found studies, and I'll leave them in the links below as well. Studies of coronectomies on decayed teeth, and they've showed no difference between full extraction and no difference between full extraction and coronectomies. And these decayed teeth, some had decay into the dentin, which is what I've got, and some had decay right into the pulp, and they still showed no difference. And I've also come across lots of YouTube videos of some other people, oral surgeons, that it sounds like they've done coronectomies on teeth that have cysts and teeth that have decay, and they've still not had any problems. Or at least, it shows that a coronectomy is an option, even on decayed teeth. So at the moment, I'm trying to get a sense of how possible it is to have a coronectomy on a decayed tooth. Because if I go on Friday to this surgery and my oral surgeon says, no, we can't do a coronectomy, we're going to do a full extraction, I want to know if I have the option to say, okay, then I'm going to not do this. I'm going to cancel the surgery. I'm going to find somebody who will do a coronectomy. I want to know if I can do that, or whether I'm just going to find another oral surgeon. They're going to say the same thing. No coronectomies on decayed teeth. At the moment, my feeling, my hunch is that coronectomies, I think a coronectomy on my tooth is the right. I don't think it is as decayed. My sense from looking at other cases, I think a coronectomy on my tooth would be the best idea. I don't know why my oral surgeon originally said that he couldn't do a coronectomy though, because it was too decayed. I don't know. Maybe he just looked at my tooth. If you look at it, it looks like it's a big gap there. It looks like a massive gap. But maybe he forgot or didn't. I mean, hopefully not. But maybe because it's at an angle, it looks like a bigger gap. A gap that big in any other tooth, and that's pretty bad. But actually, because this tooth's at an angle, it's not really that big of a gap. It's only a little bit's come off. And the fact that I've had no pain means as the decay hasn't got into the pulp, I think, is my guess. So that's where I'm at, though. Can I have a coronectomy or not? And I think I want one. Just everything about it sounds better. But I don't know anything about it. Like I've only been researching wisdom teeth for the last couple of weeks, months. So I don't know. Like I'm using my imagination to imagine how a surgeon will get my teeth out. I'm thinking, God, how the hell do you get that root out without touching that nerve? I'm watching videos and it's like they're drilling and they're using this kind of like, what is it, like not a wrench, but like I can't remember what they call it, but they're kind of like levering up and scooping out these like bits of teeth, sectioning it off and stuff. And it's like, how are you not going to hit that nerve, man? It's like, but maybe I'm not the expert. Maybe from their point of view, oral surgeons, they've done this a million times before. Maybe it's very easy. Feels weird though. Like, feels like have they not invented a better tool to just you can just exactly go round like a, you get those drills that go into the ground and they're just perfect size, something like that. Or it still feels a bit, I don't know, they're just drilling it and then taking chunks out. I don't know. I prefer the idea of a coronectomy. So you're just not even touching those nerves, and then gradually nature will just, those roots will just gradually move away from that nerve. And that feels much softer, much slower over the course of like a month, 3 months. It will just slowly move away from the nerve. And then you can pull them out nice if you need to, or we might be able to just leave them there forever. That sounds like a much better idea to me. So that's where I'm at. I've put some feelers out. I've asked a couple of other dentists, oral surgeons, if they could let me know whether they do a coronectomy on a decayed tooth. I asked my friend as well, because she works as an oral surgeon. So hopefully I'm going to hear from her at some point and find out what the situation is, whether I can have a coronectomy on a decayed tooth. And then if they all come back with like, no, it's really dangerous to have a coronectomy on a decayed tooth because, it increases the chance of infection in your roots. The chance of infection in your roots, I still feel like that even if it's like 75% chance of infection, I still feel like, well, can't we just try that first? And then if I get infected, then go back for the roots and just hope that I don't. Um, you know, I mean, I'm planning to be super careful with the aftercare. I'm planning to be like proper just liquid diets and super soft diets, nothing with nuts and seeds or anything that could get trapped in there. I'm going to eat everything on this side. I have lots of salt water rinses. Don't use do anything vigorous. Just keep it very, very light. Don't disrupt the blood clot. Keep it super clean. I'm not going to be doing any work for 8 days. I'm not going to leave the house for 8 days. Probably, well, maybe after a few days I might go in the garden. But I'm going to be super careful with it. So that logic of like, why not just try a coronectomy first? Then if it fails, then go back for the roots. Now, maybe the downside of that is that you have to open up the wound again to go back for the roots, and it's going to take it longer to heal and things like this, possibly. But all of this stuff is just all temporary stuff. If it's going to take longer to heal, yeah, it's an inconvenience, but it's temporary inconvenience. The permanent nerve damage one is the one that I worry about the most, because that's just permanent. So yeah, it's hard to judge. Yeah, that's where I'm at. That is where I'm at, and I'm just kind of like preparing for the recovery period. I've got a sneaky feeling I'm worrying about it. I'm not worrying about it that much, but I think the recovery. I'm expecting it to be more painful than it actually will be. From what I can tell, a lot of people deal with it okay. I don't think it'll be that bad. I'll take some painkillers. It'll be all right. It won't be as bad as this pain that I had for here, so it'll probably actually be manageable. I'm a little bit worried about like bruising and like how well my body is going to handle it, because generally I don't think I've had a problem with my body heals fine. Never thought of myself as somebody that bruises easily. But just recently I found a massive whopper of a bruise on my shin. I don't even remember. I must have cracked my shin on something. I crack my shin quite commonly, so I must have cracked it on something and just forgot about it. Had a massive whopper of a bruise that lasted there for 2 weeks. And then recently I had my blood drawn, and I had a big bruise there for about 8 or 9 days. And I think it's normal, so I don't think I need to worry about it. But it's like, and I've also got a tiny little scratch there, little tiny scratch. But I picked the scab, and that's been there for like 2 months or so, maybe more, and it's still not healed. And it's just making me think, God, maybe I take ages to heal. But that might be, maybe it's because I picked the scab. Most of the time, most things heal all right. So yeah, and I did when I did the blood test, it came back that I had actually quite low platelet count and quite low lymphocytes and neutrophils and white blood cells and stuff, which is all about immune and healing and stuff. And but the report said that it might be to do with I may have had a recent infection. Sometimes if you had recent infections, the levels just get depleted, or the time of the testing. Sometimes if there's delays in testing, these numbers can be skewed. So might not be anything. I'm at the moment I'm just assuming it's not. I've never really thought of myself as somebody that has bruises easily or bleeds or anything like that. So I think I'll probably heal okay. Everything else was healthy on my blood tests, and I'm generally pretty healthy. So, yeah. So yeah, and then the recovery, I'm just gonna have some liquids for the first day, then soft foods. I think most of my diet is already quite soft, and anything that isn't, like I don't know, like I have Otivix in the morning, I'll just leave it soaking. I think Otivix will be all right. I need to check because I don't want to get anything stuck in the hole. So maybe day 3 I'll do liquids for the first 2 days, and then day 3 or 4 I'll go for soft foods. But I eat like peas and carrots, just tinned. They're quite soft, and beans. Oatmeal is pretty soft. Bread I could probably manage. Bananas. Might try some mincemeat. That's pretty soft. So yeah, I feel like the soft food diet actually won't be. A lot of the foods I eat are already pretty soft anyway. So That shouldn't be too bad, and I'm probably not even going to notice it that much. Get the painkillers. Hopefully everything will go okay, and it'll all be fine. But yep, I just waffled like crazy. I just wanted to vent. This isn't one of those videos where people kind of like, this isn't. I'm not making this for other people. I'm making this more for me. And then if it helps other people, great. Yeah, that was just a big mind dump of all my thoughts at the moment. Yeah, it's annoying though. Sometimes I have these. I've had a few days where I've kind of gone in denial and just woke up in the morning and just wished it wasn't true. Like, because it's really weird. I've got no pain there, and it's like, why am I about to go through this potentially quite life-changing surgery where I may have permanent nerve damage? Why am I about to put myself through this when I've got like no pain and my teeth are fine? And it's but then I look at it and I think I have to get it out because I can see how it's pushing against that one, and I don't want to lose this tooth. I've tried to think of other things like, do I have to get it out? What about if I did just lose that tooth and just left that one in and put a filling in it, and then if it's decayed, then eventually it's going to decay, and then I'm going to have to get it out anyway. Can you do root canal in that tooth? Maybe. If I just lost that tooth, I mean, it might be an option. I'm not sure. But then I don't really want to lose that tooth. I almost feel like losing that tooth would annoy me almost as much as having permanent nerve damage. But probably not. But yeah, that's a nice little chomper, that one. So I don't really want to lose that. And that would be 100%. If I decide to lose that, then that would be 100% I'm losing that tooth. Whereas at least with this surgery, there's a 75% chance I won't get permanent nerve damage. So I think I'd probably take my chances and just try and hope that I don't get permanent nerve damage and lose that tooth. Because then I might be able to keep that tooth and get no nerve damage, and everything will be fine. So I think I'll try that. You got to have a little bit of courage, don't you? Yep. So I think that's all my thoughts. Yeah, there's the nerve. There's a 3D picture here as well, although you can't zoom in. But there it is. Anyway, I'll leave it there. Yep, I'll try and make a follow-up. If I feel like it, I may. I don't know. We'll see. The plan is to make a follow-up at some point, but I'll see how I'm feeling the other side of the surgery. Might not even happen yet, because if I get there and he can't do a coronectomy, I might call it off. But that's where we're at anyway. Okay, thanks for listening. See you later. Bye-bye.